Okay, I just shared that ethics PDF, not a proper note, just e-medicine, that's 70 some questions, the like summary. Then I screenshot each that yellow part. Then I have added it. Okay, so you can give it a read later if you want, but I don't know it will helpful or not because I already done. That's why that only small theory part is enough for me. Okay, so yeah, that's what I have only took the one screenshot from each question. Otherwise, it would be so hard. Okay, so next we will discuss about discrimination. So what is discrimination? So, what is discrimination, doctors? Who can tell me what is discrimination? What is discrimination? Okay, conflict of interest. So, what is discrimination? What is it, doctors? You should know, right? Discrimination. Okay, I'll explain. No worries. Okay, so discrimination in healthcare. Discrimination occurs when a patient is treated unfairly or differently without clinical justification because of a personal attribute rather than their health needs, right? It's basically like unfair treatment based on race, language, gender. We can like some we can we can give example like a racist doctor. Yeah, this is a discrimination, right? Yeah. Then so, what are the why unfair treatment? Because sometimes it can be due to age, sometimes due to sex or gender identity, sexual orientation, race or ethnicity, disability, religion, pregnancy or marital status, social economic status, indigenous status, then HIV status or other medical conditions. So these are the factors that can trigger discrimination, right? Discrimination, you can just remember it as a unfair treatment. Okay, unfair treatment due to these criterias. Can be age, can be ethnicity, like that. So we have different types of discrimination. We have direct discrimination, indirect discrimination, and systemic discrimination. So, direct discrimination means treating a patient less favorably because of protected attributes. So, these are the attributes, okay? The factors due to the protected of these attributes. So, indirect discrimination, neutral policies that disadvantage certain groups, right? So give me a good example for indirect discrimination. If you are familiar with recalls, you should know this properly. I think they have given this question in June or July. So who can tell me give me an example for indirect discrimination? You don't know, doctors?
Doctor discrimination between the native Australians or indigenous aboriginals.
No, no, yeah, doctor, I know. I'm just asking, do you remember? There was a question, there was a recall uh, under that topic, indirect discrimination. I'm just asking, do you remember that one or not? Do you remember?
No,
We have,
doctor, no.
yeah, we have. Do you remember that one question with the non English speaking patient and asking for the interpreter? Do you remember? Okay, we will discuss one of questions related to that. Yeah, okay. So if you are doing exam on February, you should you know, right? Because actually, please at least do 6 months back. Like if you don't have time, I know the February doctors actually now don't have time for the recalls. Like to go each and everything, but I'm telling for the March doctors, please try to cover 6 months of recalls at least. But if you have like no time or like you can't manage, at least do 3 months back recalls, okay? Because recalls are very high and you should know how to do. You have to revise the topic and key points, right? Like that. Okay. Then I have added some scenarios that can explain a refusal to treat patient with substance use disorders, inadequate pain management in indigenous people, bias against patient with mental illness, and delayed or denied care based on ability to pay, discrimination attitude toward the LGBT populations, then age-based denial of investigation without clinical reason. Okay, then so here ethical principles that involve in discrimination, justice, autonomy, beneficence, and non-maleficence. So justice, fair and like we should not treat we should not give the unfair treatment, right? We have to follow the ethics, right? We have to be justice, right? We have to respect the patient's autonomy, right? So what is beneficence? Act in patient's best interest, okay? The non-maleficent mean avoid harm, including psychological harm, right? Because in discrimination they are violating psychological harm. So they are violating this their psychological state. They it can be hurt, right? It can be emotional damage as well for these patients, right? Yeah. Then he also discriminatory attitude towards the LGBT population. That can be emotional damage, right? Yeah. So we should follow these ethics to overcome the discrimination. Discrimination is a unfair treatment, right? It's not ethically correct. So legal and professional obligations. Doctor must provide care based on clinical needs, not regarding those factors, right? Not according to the age, sex, gender identity, not for that. The doctor should be treated according to the clinical need, ensure equal access to investigation and treatment, right? We should be equally treated for, equally should treat for each patient, right? Use interpreter when is required, right? Some patients can't speak English, right? Doctors, please keep your mic muted. Okay, thank you. So, if patient can't speak English and she's asking for an interpreter, we should provide it, right? Make a reasonable adjustment for patients with disability, maintain professional boundaries and cultural respect, right? Breaches may be lead to the medical AFRA actions, right? When refusal of care is acceptable, refusal is not discrimination if there is a lack of expertise with appropriate referral, risk to the staff safety. So give me example, refusal of care. Give me example of refusal of care. Okay, if some doctors uh, are not interested to do the abortions, right? In that case, the doctor can explain the interest and their situation. Sometimes it can be due to some religious problem, so they can explain and they can refer these patients to another GP, right? So that's a refusal of care that not under discrimination. Okay, you should know that. Okay, there's a question. Okay, I'll give the answer. So, hmm, a medical student observes different patterns of behavior during their clinical placement. They notice that some patients receive varying level of attention and care that appear to be influenced by non-medical factors. Which one of the following scenario best describe discrimination in healthcare setting? I'm giving examples. Prioritizing emergency cases in triage based on clinical need. One, Then prioritizing emergency cases in triage based on the same one. Then providing additional support services to patients with disabilities, offering gender specified health screening program. Fourth one, referring non-English speaking patient to only to specific doctors. What do you think, doctors? Okay, first one, prioritize emergency cases. Okay, that's prioritize. Then second one, providing additional support to service of patient with disabilities. Then third one, offer gender specific screening. The fourth one, refer non-English speaking patients to only a specific doctor. So what do you think? Mhm. Okay, let's check why. Here, the correct answer is referring non-English speaking patients only to a specific doctors. This representation discrimination at the restriction patient choice assess the health care based on language, potential leading to a delay in care and reduce quality of service. While having doctors who can communicate in different languages valuable, automatically restricting people to only these providers is discriminatory. So incorrect options can be explained. Prioritizing emergency case is appropriate, right? Automatically scheduling all the paper with multiple I didn't read this part because it's very large part, right? Comorbidities for longer appointment times. This require reasonable accommodation for uh, complex care needs people, right? Providing additional support service to patients with disabilities. This also okay. Offer gender-specific health screening. This reflects evidence-based medical practice tailored or to biological needs. Then here, discrimination in healthcare setting can occur based on protected characteristics include age, disability, gender, race, religion, and sexual orientation. Healthcare providers have legal and ethical obligations to provide equitable care to all patients regardless of their background. Discrimination can manifest as both direct, overt, and indirect systemic form healthcare delivery. Yeah, doctor. But the thing is, then we have to keep the patient waited until the doctors arrive, right? Patient have to wait. So why we can't arrange the interpreter, right? So we can arrange the interpreter and do the care as others. Otherwise, these patients have to wait like until the specific doctor has come, right? So in that case, we can use the interpreted option, right? That's the telling. Hope you understand. Yes. Okay. Yeah. That's discrimination. What else we have? Okay, I'm gonna stop this one.